iTunes U is an app for the iPad, iPhone, or iPod Touch. The U stands for University, since the app allows access to free courses that are taught by instructors in schools and universities. In addition to access to free lectures, videos, books, and other resources, the iTunes U app supports features that let you view the course assignments list, track your progress, make notes as you go, and see the complete list of materials the instructor is using or recommends. This is a ubiquitous learning or U-learning or mobile learning environment. The appearance of the iTunes U app is much similar to iBooks. This is the iBooks appearance and the iTunes U appearance. It has a bookshelf where your courses will appear. You can also look at the courses in the list view, and you can edit them by deleting and removing the unnecessary ones. Today, I'm going to take a look at the use of iTunes U in the context of anatomy course. The course title is Gastro-intestinal tract anatomy. It's an actual course that will be provided in session to second-year medical students at University of Sharjah College of Medicine. The course instructor shares an enroll code with students. Each student enters the code in iTunes U app by tapping the enroll button in the catalog. So this is the catalog here. You just go down and there is an enroll code. So here you have to sign in with your Apple ID, and then you enter the enroll code that is supplied by the course instructor. The course instructor receives the enrollment request, and once it's approved through iTunes U Course Manager, like here, now I only have one student. This is a trial, and I have approved this student through the iTunes U Course Manager. Once the student is approved, he or she can use the course. Now let's view the course. This is the course here, Gastro-intestinal tract anatomy, after being approved by the course manager. The course comes with an overview description of the course in the Info tab. This is the Info tab here. This tab also tells about the instructor. In the outline section, it gives you a complete syllabus of the course according to weeks. The overview, instructor, and outline are the default sections of the Info tab. Additional sections can be customized by the instructor. For example, here we have additional resources section. This section lists recommended resources and additional material that are generally used during the course, including textbooks, websites, etc. Specific course materials are given where necessary in the course posts and assignments, as we will see in a moment. On the right, you will find that in addition to the Info tab, there are three other tabs: Posts, Notes, and Materials. These are fixed tabs in which the course materials are customized and distributed within them. We have just explored the Info tab. Now let's see the Posts. This tab contains work posted by the instructor to all enrolled students, including messages and assignments. The posts are distributed according to course syllabus. For example, here I'm showing the posts related to the introduction to gastrointestinal tract week. So the syllabus, as you might have noticed, is distributed among 6 weeks. You can either review the posts according to the items in the course syllabus, or you can review the assignments according to their due dates. For example, here we have assignments on the 3rd of February, 4th of February, 5th of February, and 10th of February. So these are the assignments for the 3rd of February, for example, and the assignments for the 10th of February. Now let's look at the first assignment. This is on Sunday, the 3rd of February. There are resource sessions and practical sessions. If you tap on the first assignment, you see a list of objectives here of this session. And then you can download a PDF file of this session. So this is the PDF file here of the resource session. It's a histology session, histology resource session. And remember that you can take a look at the metadata before the download. So this will give you an idea about what is inside this file, its size, number of pages, the date that it has been added, and the description of its content. You can delete it or you can mark it as unviewed again, so that to return back to it later on. Now let's move to the practical and take it as another example here. This is the again the objectives, and here these are the metadata related to the practical session, and you can download and view the practical session. See here, the practical session has a collection of labeled photo micrographs of the glass slides you are going to examine in the lab. And at the end, like in many of the sessions, you will have some self-assessment questions here at the end of the session file. The same thing is with other assignments. For example, here we will see the anatomy of the stomach and gastroesophageal junction. You can read the objectives of this session. It is a resource session and a practical session. In the resource session, you can also view the metadata of the file, and then you can download the file from here after you feel that the file is useful for you and you have to download it. See here, the file is being downloaded. It's 9 megabytes. Might take a little bit time. Now the file has been downloaded, and we can view the file. It's a PDF file about the gross anatomy of the stomach and gastroesophageal junction, and it contains some clinical, surgical, and radiographic and sectional anatomical information. The practical session here that accompanies it again needs to be downloaded. Once you are done with a file, you can tick it as it has been viewed by you, or sometimes you can just mark it as unviewed and remove your tick so that you can return back to it if you have not finished the task completely. Now the practical session file has been downloaded completely and we can view it. See, it contains some surface anatomical tips on the plastic and plastinated models that are available in the practical section, bony landmarks, the regional anatomy. These are plastinated models and plastic models, and sections, whether plastic sections or plastinated sections in different orientations, and radiographs related to the stomach and gastroesophageal junction, whether baryomes or CT scans or angiograms, in addition to the important feature here, which is the concentration on the endoscopic anatomy, normal endoscopic features of the gastrointestinal tract. Again, here you can see that there is an assessment slide. This is another assessment slide, and here is another slide asking for identification and assessment. So about 3 or 4 assessment slides are provided at the end of this session. In each week, in addition to the syllabus item posts, there are 3 designated posts. The Human Anatomy Education channel on YouTube, selected YouTube videos, and the self-assessment post. Human Anatomy Education channel on YouTube is broadcasted by the instructor to support classroom teaching with videos that emphasize applied aspects of anatomy. The videos are captured from a variety of cadaveric dissection, plastinated specimens and sections, plastic models, bones, radiographs, PowerPoint presentations, and histology photomicrographs. The channel also includes some self-assessment videos. So during each week, this post will contain a link to one or more Human Anatomy Education YouTube videos. Before watching the video, the student can look at and read the metadata related to the video, which includes the objectives and what is the student is going to expected to understand after watching this video, and then the student can link to watch this video directly on the YouTube channel. For example, here this video is related to the surface anatomy of the abdomen. Also here on the YouTube channel, the student can read more about the video and provide interactions about and comments about the video. After watching the video, the student may directly comment on the video, or he can send a message to the instructor. Actually, direct comments on the video in the YouTube channel is preferable in order to engage as many students or viewers as possible in an interactive discussion. So the students can see here you can see the comments of the other students on the video, and sometimes discussions about the video can take place between the students. Keeping the videos in the YouTube channel provides the additional advantage of viewing them on an online social network where they engage the viewers in multiple ways of interaction, including commenting, liking, disliking, favoring, and sharing through other online social networks, or sending the link via email. Now, in the selected YouTube videos posts, you will find links to videos that support your learning in YouTube channels other than Human Anatomy Education channel. These links are carefully selected to show as much of the required objectives as possible and to match the student level of anatomy knowledge. The links include multiple themes like surgical operations. For example, here we have a video on laparoscopic Nissen fundoplication. Again, the student can read the metadata of the video before linking to the video, and then the student can view the video on its own channel.
The left lobe of the liver is retracted, exposing the GE junction.
In addition to surgical operations, other links can include videos related to physical examination, procedures, sketches, 3D animations, and dissection. The self-assessment section contains a variety of assessment tools, including multiple choice questions with a clinical vignette, pictures, and videos. They are designed as hyperlinks to posts on Human Anatomy Education page on Facebook. Now, this page was established in September 2011 and is administered by the same instructor since then. Let's take, for example, the first assessment post, air under the diaphragm. Before tapping on the link, you may explore the metadata of the link. For example, here you will find that this is multiple choice question with a clinical vignette. So when you tap the hyperlink, you will be able to view the radiograph. Provide your comments and become involved in a discussion with other Facebook page fans. The instructor will receive notification about your engagement in the post and can provide feedback as well. Now, by using the Facebook page as a standalone platform, it will be difficult for the student to explore all posts that are related to the current week objectives. One reason is that Facebook does not yet have search tools from within the page. And the other reason is that in many instances it's time consuming to go back into the timeline in order to visually search for relevant posts. So by assigning links to the self-assessment post, you can combine the advantage of Facebook as a social network, online social network platform, with the current course syllabus. The advantage of posting on social network is to provide a suitable medium of a group of students to interact and discuss with each other or with the instructor. Let's take another self-assessment example, the CT of the abdomen. Again, we can view the metadata of this link, the description showing that it's an axial CT of the abdomen and asking about the approximate vertebral level and identification of certain structures. We can link again to the Facebook page, and you can answer the question or see the interactions of other students. And once you are done, you can mark the assignment as complete. Now let's explore the Materials tab. If you want to see all the materials in this course, they are collected in the Materials tab. The materials include video, books, documents, apps, images, and web links. The documents can be PDF file, Word or Pages, PowerPoint or Keynote files. You can view them all, or you can view each category separately. For example, here, let's go to the apps. These are the apps that are recommended for this course, and you can directly download or buy these apps if they are not already being downloaded, or you can link to these apps immediately from this place. Also, you can view the books. The books should be iBooks. The books provide links to the ones that were created by the iBook author. I'm showing you an example of one related books, and I'm in the process of developing my own. In the iBook, you can highlight a selected area here. For example, I will highlight this selected area here, and I can add a note to it. This area will appear in the Notes tab of your course for future revision. I will return to this point in a moment. In the Videos section, you will be able to watch a video that is uploaded by the instructor or is available in iTunes U. The video can be downloaded to your device, or it can be streamed. I didn't upload my own videos in this course material. Instead, I replaced them with links to their location in YouTube channel to retain the advantage of viewing them on an online social network. Therefore, in the video section, you will find a list of recommended videos originally present in the iTunes U store. The down arrow is for the download, and you can also view the metadata of the videos to have brief info about the video, and you can view more details in the catalog, like here, view in catalog. It will give you a better idea about the video and where is it located in the collection of videos on iTunes U. Now, as you are watching the video, you may tap the Notes button to jot your notes about the video. These notes will appear in the Notes tab as linked to the video. And when you are done watching the video, you can tap back again and mark it as complete. Now, mark as view. Now let's take a look at the notes. See here, I have two notes. One of the notes that was taken while I was reading the iBook, and the other note was written while I was viewing the video. I can add any other additional note here. And these notes can be deleted or they can be posted by email or on Twitter or Facebook, on online social networks. Now, returning back to materials, I will show all the materials now. There is a search option. And this allows you to select specific material within the course. Particularly, this is useful at the time of revision before the exam. You may search, for example, for the word question, and you will get a list of all the self-assessment questions that were uploaded during the course. And this is because each question was tagged with the word question at the time of upload for easiness of retrieval. The same is true if you want to watch all the videos that are related to Human Anatomy Education channel. All you have to do is to search the word HAE and you will get the list. Again, because these links were tagged with HAE at the time they were uploaded as course material. The way this course is designed will allow the student to have all the course material on iOS handheld devices. The students can view the course at different times and from different locations. There is flexibility in following and retrieving the course materials. Assignments can be accessed either according to schedule or according to search keywords. It also creates an environment for learners to interact with each other and with instructor by incorporating links to online social network platforms like YouTube and Facebook, which are operated by the instructor.